Hi there, and thank you for joining us for this Clackamas County Emergency Operations Center update. COVID-19 cases continue to rise in Clackamas County, and this is putting us on the cusp of going into extreme risk. Our Public Health Director and Disaster Management Director provided the Board of County Commissioners an update on the status of COVID-19 cases in the county. Let's listen in.
So first, here in Clackamas County, we have 15,557 total cases and 204 deaths. That is up 483 cases and 2 deaths from last week. We've been, of course, tracking the ups and downs of our cases. We now have 525 for this week, which is up from the 438 from last week. And again, we're still on that upward climb. The COVID positive patients that are in our Northwest Oregon hospitals is rising. We have 138 when this was done yesterday, and we are continuing to see that rise here in the region. And when we talk a little bit more about hospital data, it's probably going to continue to rise with our case rising as well. So here we're seeing that the staffed adult ICU beds in the Tri-County area is not, at this time, is not changing a great deal. It is still being pretty steady. And of course, we're keeping a very close eye on that too as our cases go up. But in the last 2-week period, we went up to 212.3 for 100,000 population, and our test positivity rate is 6.8. Without the hospital metrics that were added by the governor a couple weeks ago, that would be kicking us back into high risk if it were a movement week, which it is not. So Philip's going to cover that a little bit more in just a few minutes. I don't know, Philip, do you have anything else on this slide?
The state of Oregon did release an update to the process for when counties are moving, if they have to move from high to extreme risk, and it's based on this hospital capacity metric. We did not meet this metric, which is a very good thing, which means that for 2 additional weeks starting this Friday, we will remain in high risk and not have to move back into the extreme risk level. It is concerning that our case counts continue to increase. We're seeing more community spread and limited vaccine supplies still. So, we're working really hard in public health. Our focus is to get vaccine into arms for everyone who wants the vaccine. Currently, for all folks who are 16 years old and older are now eligible. However, the story continues. We do not have enough vaccine supplies for everyone who wants it. My hope is that in the weeks and the next couple of months to come, that will change. Hospitals, as Nancy showed, we are seeing an increase in those hospitalizations. So we are concerned that 2 weeks from now, we might be in a situation where if this pattern continues, we could, as a community, be moved into that extreme risk level. But you can see just over the past, since the beginning of March, that the number of outbreaks we have in all settings has increased. Schools that we've talked about quite a bit, workplaces of all types. We've even, we've seen where long-term care facilities and retirement facilities had gotten really small in the single digits, and that was great. This week we are at 11, so that's a little bit concerning. The vaccine is not required, so we do have some staff, we do have some residents in these communities that have chosen not to get the vaccine. We continue to meet with facilities and try to encourage that to prevent this from happening. The work really continues, all hands on deck. We have vaccinated over 157,000 people in Clackamas County as of yesterday, which represents a little over 37% of our total population. So this is new data I wanted to share. This just shows different populations broken down by race and ethnicity, the percent of the population in the county that they make up, the number of people within each of these groups who have been vaccinated. And in the far right column, that our starting place and the way we've been thinking about this in public health has been one of the first goals is to get each of these populations to that 70% threshold, 70% being in general what's needed to achieve herd immunity. So if you think about that for each of these populations, the number on the right is the number of people we still have to vaccinate to meet that metric. I want to encourage everyone to go to getvaccinated.oregon.gov where you can pre-register And now our local events are now added to that. So if you register that, you'll also get notified if there is a appointment available in Canby, in Sandy, in Malala, or in North Clackamas. So you will get the opportunity to get alerted when an appointment becomes available. And that's really helpful, so you don't have to continue to always check the web pages. There's many of this. This is not a centralized system or process to get appointments, but that should help. And if folks have technology concerns or they want to need some additional support, they're welcome to call our phone number, our call center at 503-655-8224. There's a wait list. We also have seen some no-shows, so we have a standby list, and we will plug you into an appointment as quickly as one becomes available for you. The hard part is we aren't able to vaccinate as quickly as we can to really slow down this increase, so we need the community's help. As individuals, as we continue to reopen and loosen the restrictions, just in terms of our own personal behaviors, we really want to encourage people to stay home if they're sick or if they've been exposed. Continue following the precautions that we've been saying for over a year, wearing the mask, keeping your distance. The weather's getting better, so take your gatherings outside if you can. Participate in contact tracing. We're seeing about 40% in the last week. We haven't been able to reach folks. 40% of the cases, they either haven't answered our phone calls or they've refused. So that goes a long way to helping us and helping the community. And of course, get vaccinated once it becomes available. For employers, flexibility. We are trying to provide more weekend options, more evening options for folks because now frontline workers are eligible. Getting an appointment during the day is tough, but there's also a new federal program to provide a tax credit for employers where you can provide paid time off to get the vaccine. So we want to encourage and promote that as well.
If all the metrics align, Clackamas County could enter the extreme risk category on May 7th. Please keep up to date on the status of COVID-19 in our community so you can prepare for any changes in risk levels. Also, please continue to do everything that you can to protect yourself and your community from COVID-19. This means to keep up on wearing our face coverings, watching our distance, and getting vaccinated. You can learn more by visiting our website. Thank you very much for joining us, and we will see you soon.